Welcome to the Clinician Voice podcast. I'm Robin Geiger, CNO for Ingenivis Health. I'm excited to connect with our guest today. We have the pleasure of speaking with a nurse executive with significant experience and knowledge about authentic leadership. Dr. Dawn Heath serves as the Chief Nursing Officer at Southern Ocean Medical Center, SOMC, in Manahawkin, New Jersey, part of the renowned Hackensack Meridian Health Network. Under her visionary leadership, SOMC has achieved their second magnet designation and upgraded cardiac catheterization lab licensure, expanding access to life-saving cardiac interventions and furthering her commitment to advancing cardiovascular care. Dr. Heath received national recognition from the American Association of Critical Care Nurses and is a Circle of Excellence winner. She also received her American Organization of Nursing Leaders Nurse Executive Fellowship, and she continues this dedication to nursing leadership with her nurturing guidance of the multidisciplinary health team that she leads. Please join me in welcoming to the podcast, Dr. Dawn Heath.
Hello, Dr. Geiger. Thank you for having me today. I'm really, truly grateful for this opportunity. I've been looking forward to this conversation, and I'm excited to share my thoughts.
Excellent. I'm glad that you're here. I'm glad I could pull you on the podcast just to hear more about everything that you're doing and how you're able to keep your team happy through everything that you do as far as leadership. So if you're ready, let's get into the talk.
Great.
Tell me about your current role and how you came into leadership.
So as Chief Nursing Officer, I do oversee the nursing team, ensuring quality patient care and staff development. My leadership journey actually began at the bedside, I'm sure all of us did, where I witnessed the impact of strong leadership on patient outcomes and staff morale. This experience fueled my passion for leadership, and I pursued many opportunities to grow my skills and my knowledge, eventually leading me to this position. There have been several experiences that have shaped my leadership style, witnessing the dedication and compassion of nurses, of course, during challenging situations like what we've gone through the last couple of years, absolutely solidified my belief in the power of teamwork, collaboration, overcoming obstacles, and just navigating complex situations, which has taught all of us to be more resilient, try to be more adaptable, and of course, always leading with clear communication as best we can.
Right. Thank you for sharing that. And we talked just a bit, or we've hinted about authentic leadership. I'd love to know how you define authentic leadership and why it's important in the healthcare setting.
I define authentic leadership as really being true to yourself, but more importantly, being true to your team. You have to role model the way. I mean, I make mistakes, I own it. I'm very transparent. You get what you get. I work very hard to have self-awareness, whether it's with my strengths or my opportunities. But being transparent, being open and honest in your communication, absolutely role modeling and acting, according to your values and your beliefs. Right. You have to have empathy, right? You're not always going to agree, but you just have to empathize with the situation and really listen to your team about what's going on versus jumping in. And really, sometimes, whether it's the front line or myself, we have to have the courage to do the right thing, stand up for what really needs to change. And, at Hackensack, it is one of our core beliefs is to have courage and to do the right thing. So it's great to also know it's part of our behaviors and the expectations, especially at our facility.
Yeah, that's commendable. And you mentioned role modeling, and that brings me to think about mentorship. And I'd like to talk about mentorship a little bit because it sounds like it aligns definitely with how you lead. So, what are your thoughts about mentorship and how do you incorporate this type of support within your nursing team?
Well, mentorship for me is really being connected with all the team, right? Whether it's frontline or assistants or nurse managers, really needing to know what their needs are to help them grow professionally or personally, or through their education. We do have many leadership programs that we try to connect, but more importantly, I love mentoring. I love connecting people throughout the network, with what their needs are. We recently did have, a leader that came to me a couple months ago, and she said, I'm finishing up my MBA. I'm really looking for that next opportunity. So just having all that information and them
That's
feeling
awesome.
free that they can come here to my office or speak to me. We're always out and about. Our admin team here is always out and about. Just talk to us about anything. So all the doors are open. And we were able to, I went and found her and I'm like, listen, we can never guarantee, right? But
Right.
she was promoted and we're really excited because in the last, I would say 6 months here, we did have some leadership turnover and we
Mhm.
were able to elevate five of our team members
That's
to the
awesome.
next nursing leadership position. We
Mhm.
had bedside nurses that became assistant nurse managers that have been very strong
Wow.
charge nurses. We have assistant managers that became nurse managers. We had a supervisor that became uh, a nurse manager. So really proud that even though is this, our facility is a smaller community hospital, that the team and the bedside RNs, registered nurses, really saw the opportunities that we were creating by succession planning, identify those high performers, and really helping them and having those conversations all the time, whether it's me, our director, our nurse managers, and really keep that pipeline flowing because nursing leadership is difficult, right? It's not a staffing's always hard. So
Right. No, that makes sense. And so I'm wondering, like, what are the key benefits that you've observed from mentorship programs? You definitely shared a few in terms of employee retention, skill development, and just overall organizational culture.
well, I think by mentorship and mentorship programs, we're empowering our nurses. It is definitely providing that professional growth and job satisfaction. We
Okay.
are giving them the resources and training they need to succeed. We give them the opportunities to take on the leadership roles, as I just mentioned. Absolutely
Right.
to participate, being a magnet facility, we do have shared governance, so we do want them to participate in shared decision making. And
Mhm.
we're big on recognizing and celebrating everyone and anything we possibly can, whether it's 100 days, no falls, our
Mhm.
leapfrog scores, uh, patient experience, celebrating advanced degrees. We are out
Right.
and about morning, noon, and night. And
Mhm.
I do think this creates a culture of learning development. It's providing that fellowship. And I just think we're moving more around the building than, leaving the facility or the organization.
I love that. So you're definitely building culture and empowering your team. So thinking about mentorship, what role has mentorship played in your own career journey, and how has it influenced your leadership style?
Definitely, I think those strong conversations as you're coming up the ranks, you don't always see that blind side and those opportunities. I remember one significant conversation for me that I learned to take in, and it really led me to the level. It was a 3-year journey after that difficult
Right.
conversation that my CNO had for me. And I remember talking to a nurse manager I worked with at the time, and she's like, you're doing what you said you were going to do with some of the opportunities that were shared with me. And when I was leaving, the other facility to come down here for my first CNO position, um, she said, you did what you said you were going to do. and you're going. So it's hard work to work on those opportunities, but if
Right.
you really want to be authentic, you have to acknowledge that, right? You have to be vulnerable and you got to own it.
I love that. So you definitely took the feedback that you received from your mentorship, and that influenced your leaderships. And I love that. How did you approach succession planning within your organization for your own internal talent? Because it sounds like that you have a lot of that going on, that there's definitely been some growth and some promotion internally within your teams.
So it's definitely always evaluating that you have, the person that might be a year out, the person that might be 2 to 3 years out, even that person that might be 5 years out. We want to identify and get them in the programs early. We are fortunate that we have programs that start right at young professionals where without a leadership title, you could be in it. This helps us. Plus, a lot of at least the nursing stuff that are in nursing school. I mentor, I have a DMP student now. I had a couple MSN students last year. They're always reaching out to us. I
That's
had
awesome.
someone from another facility that I used to work at within the
Yeah,
organization that spent some time with us too. So I think it's about keeping those lines open, no burning bridges, and because your
absolutely.
succession plan could be outside the building, but inside the organization. So that part's exciting that we do get to have that ability to share.
That that forward planning is definitely important. I'd like to shift a little bit now to talk about self care. It would be great for our listeners if you could share, how do you maintain a healthy work life balance? And what advice do you have for others, other leaders specifically, in regards to this?
Well, I would have to start with we can all do better. I
Absolutely.
think this is all we hear about is self care and well being, and
Mhm.
taking care of ourselves. For myself, have to try to set the boundaries between work and life and make sure that you're getting the fun things in, like you know it's close of the summer, but I am a beach girl. I'm a Jersey
Yeah.
girl, and beach is my life, regardless of what my husband says. But
Right.
reading, of course, I have 4 sons, the husband, and want to be with all of them. And we have a lot of family, so that's always important on the weekends. Usually gathering at the beach, which we all prefer, which is
Love
awesome.
the beach.
Yes,
Yes.
it's all about the beach, and its calming effect and the water. I
Oh,
think for me,
yes.
but for,
Absolutely.
the nurses, it's even hard when they're on the job for them to take care of themselves. It's,
True.
they don't want to take their lunch break because they're giving their assignment to another nurse. It's the hydrating, it's the busyness, and we want the
Mhm.
patients out of the ED and upstairs into the inpatient side. So it's hard. We do have resources. We're working through that. We have many resources, but now the goal this year is to bring the resources to the nurses instead of, you know, saying, here's where they are, come and
I
get them.
agree. I
So we
agree.
did do some traveling spa days this year. We do try to get some things. We do have a culture department as a network, and then we have our culture locally that are a part of the network. So we do have a lot of stuff. If it's not monthly, if it's more, we do again the celebrating.
Mhm.
We invite when they're winning awards that they bring in their families. We do host things like we're having a bonfire on the beach
Oh, that's
yes,
nice.
next week. And
Awesome.
that's inclusive of everyone, that you can bring everybody in your family for our
Mhm.
place. So
I like
it's
that.
hard, but we do talk about it a lot and what we can do, and I do co-chair a meeting for nurse workplace environment with another front RN, and that's what we talk about. What can we do more fun at work or set the nurses up for success? But it's not an easy topic.
Right. It's
Resilience
not.
is hard.
It is, but I like that it sounds like you're doing all the right things. You've incorporated laughter and joy and sharing those wonderful, impactful moments. I know here at Ingenivis Health, we definitely, our ACT program really just sings and resonates with our nurses. And you mentioned something that actually, you hit the spot when you mentioned putting those resources right in front of them. Because just saying that we have this available, yoga is available, this is available, you have to constantly remind them because they do have such a stressful and challenging position. So that's going to be, I think, the win of everything is constantly reminding them that those resources are available. What do you see as the biggest challenges and opportunities for nurse leaders in the coming years?
Well, of course, number one is staffing shortages and figure out how we can get more nurses that are qualified and being turned away. Students from, you know, in those chairs, all
Mm-hmm.
the facilities, and then you have difficult placing them for clinical work. So I think that's continued. New Jersey's definitely going to feel that here. The burnout. The nurses are leaving part-time and full-time to be per diem and
Right.
have a lot more control over their well-being, right? And then there is also our more senior staff that might be adapting to the new technologies that are coming. We're going to advance with virtual nursing, and right, that's a whole way a different model of care. So how is that going to work? And trying to show them why, and making work
Right.
smarter, not harder.
Harder, not
It's
harder.
it's
Right.
it's we have to get there, definitely. Um,
Right.
I think we have to develop those strong leadership skills in order to
Mhm.
manage all of our teams through all these changes that are definitely coming forward.
Yeah. Changes and challenges, they're going to be continuous. And I agree, and we talked about, and you were there like in an advisory board, and thank you for your service. We talked about, you know, resiliency and what that looks like. And it's not just onus on the nurse, but it's, building those opportunities to strengthen resilience. So it sounds like you're doing all of those things. And you mentioned technology. That was my next question for you about how you see technology and innovation influencing professional growth and development. And you mentioned virtual nursing, and that's definitely one of those aspects. Would you have anything else to add to that?
Well, I think just technology in general is improving our
Mhm.
efficiency and productivity.
Right.
I think the more that we can add, and it does provide newer opportunities for patient education and engagement when we can tap into all of these other things. And hopefully, really, in the end, we're improving patient safety and increasing our quality of care.
Absolutely. Well, it has been such a pleasure speaking with you today. And you've unpacked a lot on authentic leadership and really leading with that warm self and being true, showing that true self. And a lot of leaders we don't do that. We come into work and we have the leadership hat on, but we're afraid to actually um, take a minute to enjoy our team. So I'm hoping that others learned a little bit from listening to you today. Is there anything else that you would like to share with our audience today about authentic leadership?
Well, thank you for keeping authentic leadership in healthcare essential, because I really believe it is. It is so great to create that positive work environment. I have to have joy in my job. So rounding with the teams and the patient is always, when you get bored in the office and the Zooms, you have to be out there and about there. So I would say get out there, round, meet your teams, round with the patients, learn, hear what they're saying about your team and celebrate them. Um, be yourself, know your values, be transparent and honest in your communication. Of course, always empathetic and compassionate, and really be vulnerable and hear what they have to say. Take that, upward feedback from your teams, whether nursing leadership or the front line. But thank you again, Dr. Geiger, for this opportunity today. And it's been a wonderful discussion.
Words to live by. Thank you so much for what you just shared, Dr. Heath. It's been great speaking with you today. And it was a pleasure hearing more about you and just how we can best support and grow our teams. So thank you for joining us.
Thank you.
And to our listeners today, we hope that you will join us next time on the Clinician Voice.